Hello, my name's Ian McCall. Let's have a little chat about lymphedema. It's a problem we're seeing more and more, particularly in the elderly, and it primarily occurs because of localized blockage of the lymphatic system. Now, the lymphatic system is a series of small channels. It's almost a combination of the immune system and the vascular system. But these channels run in the dermis. They're not deep down the fat tissue. They run in the dermis. And they're all interconnected over all the surface of the body, and they ultimately drain into the venous system and hence into the vascular system. Lymph itself is made up of a lot of extra proteins and water, occasionally even some bacteria and other metabolic waste products that accumulate in the skin. They diffuse into the lymphatic system and they're taken to the blood system, subsequently cleaned out via the kidneys. Now, if you have a localized blockage of the lymphatic system, then you'll tend to get, say, a limb swelling, or perhaps an arm swelling. And the commonest cause of any of this is usually either radiotherapy or some tumor that involves the lymph nodes. The lymph nodes, they're distributed in various areas of the body. You can see congregations here around the inguinal lymph nodes, the lower lumbar lymph nodes, up here in the armpits and in the neck. Now, if you get tumors that involve the drainage in these areas, then you get a backup of fluid in the lymphatic systems, and either a lower limb will swell or an arm will swell. There's even, a congenital disease with loss of these lymphatics in the skin in some areas, and that's called Milroy's syndrome. And these people are born with a chronically thickened, swollen limb at birth. One of the commonest causes of lymphedema that we see nowadays are when people have had surgery done for removal of lymph nodes, either in the axillae or in the lower limb, particularly if those lymph nodes have been involved with, say, metastatic melanoma or some other tumor, or breast cancer or the like. Now, what are the consequences of having a swollen limb like this? Well, first of all, it's heavy, it's difficult to move around, but there are big consequences to the overlying skin. You can see in this one, you can see the thickened nature of that skin. You know, it's difficult to, if you put your finger on that, press into it, you'll have some difficulty. The overlying skin reacts with the dermatitic process and also with excess scale formation, and that's what you're seeing here. It sometimes becomes quite itchy, and you can have a dermatitis in the skin as well. I'll show you some pictures of that shortly. But the end result is if you go scratching itchy skin like this and break the surface, bacteria can get in, and you can then get a cellulitis, an infection in that retained fluid, like under the skin. And that just destroys any local lymphatics even more. And so repeated episodes of cellulitis will just make a chronic lymphedema a lot worse. I've commented there that sometimes, the amount of fluid that's under the skin there is so great that when people stand up, it causes almost pseudo blisters in the skin. The fluid presses up from the dermis to the surface, and the skin is raised as a bleb. And if that bursts, or if it's pierced, the fluid will just keep leaking out the leg and be a continual problem until ultimately, you lie down, you put your leg up, and hopefully it will seal itself. Let's have a little look at some pictures to describe what I've been talking about there. These are a few images I have in my collection. Let's have a look at this one. You get a feel for the edema, the thickness of the skin. Look at the shiny surface here, the build-up of scale. That rough area there. If we have a look at some of the others. Another example of the thickened scale that builds up in the surface here. Let's look at this one. Again, here you've got an ulcer that's occurred. There's probably been infection, perhaps a bit of ischemia, and a whole bit of skin has just sloughed off here. Now, a chronic ulcer like this will ooze, weep, and it'll be very difficult for it to heal. What about this one? Yeah, that's one of those pseudo blisters that I was talking about, just with the pressure causing that to bleb up like that. It's not a tumor, it's not another growth. And when we get real thick buildup of scale like this on the surface, we call it the Mossy Leg Syndrome. This was a patient who had chronic lymphedema, who then developed an infection. And you can see the skin sloughing off here. It's virtually a staph scalded skin syndrome. And the extent to which damage can occur when someone does have chronic lymphedema. Another major issue we sometimes have is when people have had lymphedema for many years and then they develop solar damage on top of it. I mean, look at these lymphedematous legs here. Then they've had a whole lot of solar damage and developing a variety of both solar keratoses and squamous cell carcinoma. Now, you can imagine trying to do surgery on legs like that. It's difficult to get the skin together. Trying to put a skin graft on that, it just oozes. It doesn't matter how much you stitch it in there. Fluid gets under it, lifts it up, and it's very difficult for the graft to take and develop a blood supply. How do we treat that? There's a new technique called Bolus Radiotherapy, where they can just put a very thin layer of electrons into the top layers of the skin. And they'll do a sequence of treatments, over maybe about 20, 25 treatments. And they can, in fact, treat this even in a chronic lymphedematous leg, but there's always still the risk that an area will become infected or you get an ulcer. So this is one of the consequences of lymphedema in the long term in Australia, just with chronic sun exposure giving you this sort of picture. This one here is a good example of the eczema reaction and eczematous reaction that occur in chronic lymphedema. Now you want to treat that with a strong topical steroid under occlusion. This will ooze very easily, but I mean a strong steroid with a little bit of Bactroban cream, mupirocin, an antibiotic cream under a bit of occlusion there or wet dressings will allow this to settle. But it's always a risk in someone with chronic lymphedema. So, important things in management in the longer term. Well, first of all, try and avoid any situation where lymphedema is going to occur. But I suppose if you have to remove regional lymphatics and regional lymph nodes, then you know this is going to happen. When it does start to happen, use bandaging, employ physios to help with massage, and really strong support stockings. So that sort of support, putting pressure from the outside will help to prevent the chronic edema occurring and should help to prevent some of the skin consequences. But, people sometimes are very reluctant to put these support type stockings on. But if they don't, these are the chronic changes that are going to occur. Avoid getting overweight. I mean, if you get obese as well, that just compounds the problem. Don't be afraid to use topical steroids on any dermatitic thing that's there. If there's thick buildup of scare, 4% salicylic acid and soybean cream will help to get rid of that. And, there's another consequence. Sometimes if you have chronic lymphedema, you can in fact develop angiosarcomas, but that takes a long, long time for that to develop. But it's a complication that can occur in some rare cases. So, lymphedema, we're seeing more of it. Get in early, get on top of it early, keep the support up to it. Don't allow that skin to get sun damaged. Treat any secondary dermatitis. Avoid scratching and any secondary infection. Have the patient have a script for antibiotics handy at home, because if they see a cellulitis developing, the quicker they get on the antibiotics, the better. So not a condition you want, but not one that we can manage. So don't be too downhearted if you do have this. A good doctor can manage it for you. Take care.